And let's get started because my goal today is to be done in time to catch game 4.
Okay.
That starts at 6:07. So,
All right. Well, I will take roll call. How's the roll call then? Commissioner Guillermo
present.
and Commissioner Green.
Present.
I will read the Ramatush Ohlone land acknowledgement. Thank you, by the way. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramatush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramatush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramatush Ohlone community and by affirming their sovereign rights as the First Peoples. Shall we move on to item 2, Commissioner? Would you like me to call the roll, or would you like to call the roll?
No, go ahead, please.
Okay. Item 2 is the approval of the minutes of the September 14, 2020.
Okay.
Move to approve.
Okay, and I will second.
And there's several people on the public comment line, so I'll be checking throughout the meeting. Folks on the line, if you'd like to make comment on item 2, which is the minutes, please press *3 to be recognized. *3. All right, I do not see hands, so I will do a roll call vote. Commissioner Green.
Yes.
And Commissioner Guillermo.
Yes.
Thank you. Item 3 is general public comment. So folks on the line, if you'd like to comment about something that is not on the agenda, a topic that's not agendaized, please press *3 to raise your hand. *3. I see no hands. So we can move on to item 4, which is the executive team report.
All right, good afternoon, Mark. Good afternoon, commissioners, and welcome. And thank you for spending some time with us this evening. As you can see, we are doing this JCC from our desk. We have 6 surveyors here from CDPH who've been here for the entire day today, and they probably will be here through tomorrow. And they are currently in the room that we normally have our meeting in. So we may have, we don't have any, well, we may have some updates a little later. Naz may provide some updates in terms of how the survey is going. But I think the important thing is typically if there are major issues, the leadership team is called to reconvene with the survey team. And thus far, we have not had to do that today. So I think in that regard, things are going well. So if Zoe, if you could go to page 4, that'd be great. All right, so here we're going to honor our COVID response continues. It's really a priority for us. During the past month, we've been very fortunate to have a significant reduction in cases, and our vaccination rate continues to increase. As a result, we've reduced our staff testing cadence from twice a week to once a week for vaccinated individuals. And we continue testing twice a week for unvaccinated staff. Thus far during the pandemic, we've had a total of 280 confirmed positive cases. And that includes 217 staff and 63 resident cases. And this information is as of October 4th. We only have 3 active staff cases. Next slide. So after nearly 2 months of a surge in cases, the Delta variant seems to have run its course here in San Francisco. During the initial month of the surge in July, we had a spike of 21 cases, and that was followed in August by 17 cases. Our case count fell to only 3 cases during the month of September. Next slide. So during the month of September, we were focused really on preparing for the upcoming vaccine mandate for healthcare workers. And the vaccine, that mandate went into effect on September 30th. So this has been quite a process. HR has implemented a process for ensuring staff compliance. And this will also include employees being placed on administrative leave while awaiting the results for an exemption request. We've been fortunate in that our compliance rate has been really high, and so we don't anticipate a significant disruption to our operations as a result of the mandate. Next slide. So here's our staff vaccination dashboard. As you can see, we're around 98% fully vaccinated, and we only have, as of the October 1st, we only have 25 staff members who are not vaccinated. And with the recent mandate, we anticipate getting to 100% in the very near future. Next slide. Our resident vaccination rate is currently at 94%. Only 44 of our residents are vaccinated. And I really have to say that the impact of the vaccine on our residents has been significant. As you know, we haven't had a positive resident case since January. So it's really amazing. Next slide. So along those lines, the majority of our staff and residents received the vaccine immediately when it became available back in December of 2020. And so most of us now are 6 months post initial vaccine, which is making us eligible for the booster shot. So we began offering boosters back to our staff back on October 4th. And we are also doing that in conjunction with the flu shot. We will also begin administering both flu shot and booster to our residents this month as well. Next slide. So here's a snapshot of our admissions, discharges, and expirations. And as you can see, we had a slight uptick in admissions during the month of September with 24 admissions, and that was up from 17 in August. And our discharges remain relatively low, and this is mostly a result of pandemic-related constraints on discharge options. Next slide. So this month, our employee of the month is medical social worker Rita Ng. So Rita is a longtime Laguna Honda employee. She started her career here in 1987. Rita is fluent in both Mandarin and Cantonese. And this is really a tremendous asset for us here at Laguna Honda in terms of helping to better support our Chinese community. Rita really is a model of excellence in customer service, and she's been described as her team as being compassionate, patient, and respectful. And these obviously are all qualities that are really ideal to possess in our line of work. Slide. So here's a continuing look at our equity and culture work. So as we all can agree, equity really is a monumental initiative, and it's going to take us a significant amount of time to inculcate this into our culture. So we're really deliberately taking time to build our infrastructure, and that's the work that we've been doing over the past several months because we want to have a solid foundation as we go forward. And this really includes strengthening our organizational knowledge base through education and training. For example, we have 10 Laguna Honda team members who are participating in the DPH Anti-Racism Fellowship Program. And I may have mentioned this, this group meets on every Tuesday. We've now gone to every other Tuesday, but it's a 3-hour meeting, which requires a significant amount of time commitment. And that process is going really, really well. So we have 10 members that are participating in this fellowship. We also created a Racial Equity Action Council, and we have representation from almost every department here at Laguna Honda. And we've created several work groups from that council that meets on a monthly basis. And lastly, we are currently soliciting participation in the DPH Equity Champions Program. And thus far, we have 14 individuals who have applied for the champion program. Next slide. And finally, September 15th through October 15th is Latinx and Hispanic Heritage Month. We at Laguna Honda are well represented in the Latinx and Hispanic communities, and we have staff who have ancestry from virtually every Latinx country. And each year we do a display of all the flags from the Latinx countries. Here in administration, we have that display. And we also do a series of posters with bios and photos of prominent individuals from those communities, and we display them throughout the hospital. And there we have literally scores of these posters, so it's really, really very nice job. But this year, we also had the pleasure of hosting a presentation and dialogue with Dr. Richie Rubio. And Dr. Rubio is the Director of Practice Improvement and Analytics in our Behavioral Health Division. And so on Thursday, Dr. Rubio led a discussion on the search for a more inclusive name. And this was really a conversation and reflection on the evolving terminology being used to refer to people from Latinx and Hispanic communities. I had the pleasure of sitting in on this presentation, and I can say that it was very informative and very, very reflective. And I think the thing that really stood out was the fact that it's important for us to remember that individuals from different communities, in this case, Latinx and Hispanic communities, it's really difficult to try to lump everyone into one particular category in terms of searching for a descriptive name, if you will. And it was clear that various individuals, different ages, different family situations, were more comfortable with certain descriptors than others. And I thought that was really an important message coming out of that discussion. And it really helped me to, really put things into focus, when dealing and communicating with our staff here at Laguna Honda. So it was a very well done presentation by Dr. Rubio. And with that, I'll pause here and try to answer any questions.
Thank you, Michael. Should we ask Mark if there are any public comment questions from the public?
Yes, please. Folks on the line, if you'd like to make a comment around item 4, the executive team report, please press *3 to raise your hand so we can acknowledge you. *3. I don't see any hands, commissioners.
Dr. Green, do you have any questions for Michael on the report?
Oh, well, thank you for asking. Well, certainly congratulations on your excellent continued COVID work. And it's quite remarkable. I doubt many other institutions of any kind have this kind of a set of statistics, much less a place like Laguna. I was wondering, did most of your staff get the Pfizer? As you look at giving the vaccines, the boosters, I mean, is it pretty much Pfizer? Did you have individuals with Moderna? I'm curious to know kind of what the distribution was. It kind of informs how much work there'll be ahead in terms of revaccinating.
Yes, Commissioner, I think, and Wilma, you certainly can speak to this as well, but I think we're pretty much exclusively Pfizer.
Mm-hmm. Okay, yeah, I was just curious. We were as well. And so there's a push beginning to get everyone back in. Do you anticipate any issues with that in terms of manpower or compliance? You know, we've been reading that certainly the people aren't lining up for these boosters when you see at least the data coming from pharmacies around the country.
Well, while I think we are never totally out of the woods until we get everyone at 100%, we've been very fortunate because our rate has been high. And I think that has helped, just overall having the mindset of people getting vaccinated. That's kind of in our part of our culture now. But at the same time, because depending on the area of staffing, there could be issues in terms of staffing if more than one individual, right, is in one particular area. But overall, I don't think we'll have any major disruptions just because of the low numbers that we have that are unvaccinated.
Great. Yeah, great. Thanks.
Thank you, Commissioner Green. I had just a couple quick questions. One, on the equity and culture update. Of the 14 applicants that have applied to be champions, how many are we going to select from Laguna Honda?
So we are anticipating that the entire 14 will be selected. And that's really the goal. And it may be possible for us to have even more than 14, but at least for the moment, that's the number of individuals that have expressed interest. And I think I'm fairly confident to say that the entire 14 will actually be a part of the program just because of the size of our organization.
Great, that's encouraging, very encouraging. And then on the Latinx Heritage Month celebrations, I am really interested in the presentation, the conversation dialogue that you had on, a new name for the community there, because I know that there is not necessarily universal acceptance of, some of the more sort of current references to the Latino and Hispanic community. So just wondering whether there are sort of any conclusions to that. I mean, aside from the learning that I think I'm sure happened, but it would be interesting to know whether some of the thoughts and opinions about even having a new name that encompasses all of the community was, if it differed by generation, if it didn't, differed by, sort of a heritage, it's just something that I think we should all be informed about, right?
Yes, there's no question about that, Commissioner Guillermo. And I think that's really the thing that stuck with me mostly is the fact that, because it was something that I had never really considered, that it could be generational. Obviously there are, sexual orientation associations. And so I think for me, it was really just understanding that that it's more ideal to have a discussion and to make attempts to be more inclusive. And really, I think that involves listening to people and utilizing the terminology that they're comfortable with, and leading from there versus assuming that they're in a particular category. So.
Just ongoing dialogue and communication and learning there, no definitives. And I think that makes sense, that this isn't something that any one dialogue is going to solve, even just for the folks at Laguna Honda, and how you might reference the community. I mean, obviously, the same thing happens in many other racial and ethnic communities as well as in, you know, I guess all non-majority communities and populations. So I just appreciate that this is something that Laguna Honda has done and will continue to consider.
Shall we move on, Commissioner, to the next item?
Yeah.
Okay, thank you. Thank you, Mr. Phillips. Item 5 is the Regulatory Affairs Report.
Good afternoon, commissioners. Can you hear me okay?
Yes, we.
Yes, thanks, Mark. Appreciate that. Hello, I'm going to take a breath as I'm running between surveys. I wanted to share with you the Regulatory Affairs Report, which reflects the activity for the month of September. So for the month of September, Laguna Honda submitted 22 facility reported incidences, and we learned about 1 anonymous complaint from CDPH. You have the breakdown of cases in front of you. Majority of cases reported to CDPH were allegations of abuse with an even split between our resident-to-resident and staff-to-resident allegations. During the month of September, we did support a number of unannounced site visits, 4 of which are highlighted for you. Most of which focused on facility reported incidences. This is a trend we've been seeing as the team is trying to catch up on their investigations that they need to close out for us, some pending back to 2019. We did also support our 3rd COVID-focused survey, which was a great success. We are still waiting for our official CMS 2567 for us to provide our plan of correction. However, I do want to celebrate the teams. They've already implemented a number of their corrective actions, as we have to have them in place 30 days after they exit. So a big shout out to the teams that are doing that work. For that survey, as was shared with you all, I believe by Mark already, the main feedback was just around hand hygiene and glove use, and mostly for our non-nursing staff. So just reminding all our disciplines that as they go in and off the units, they need to perform proper hand hygiene, just as the rest of the clinical teams. Additionally, in the months of September, we submitted 3 plans of corrections. These were standard plans of correction, most of them for old incidences, nothing for this year, actually. And we still have 91 fries pending the start of investigations. I will pause there for any questions or comments.
Okay. Do we have any questions or comments from the public?
Sure. Folks on the line, if you'd like to make a comment on item 5, the Regulatory Affairs Report, please press *3. *3 to raise your hand so we can acknowledge you. I do not see any hands, Commissioners.
Okay. Mark, any questions from the committee members? None? A shaking of the head. Okay. Thank you, Naz.
Thank you so much. Appreciate it.
And good luck with the back and forth of the surveys. It's a lot of very
Thank
important.
you, Mark. I'm going to turn the video off. I apologize, but I am here if you need me.
Okay, thank you.
Thank you.
Item 6 is a presentation for fiscal year 2021 facility assessment.
Okay, great. So we're going to hear from Fiona Chin and Vanessa Gutierrez.
Vanessa is out sick today, so I will present by myself.
Okay, thank you.
This is the fiscal year 20 to 21 facility assessment report. The facility assessment, sorry, can we do the next slide? The facility assessment is a CMS phase 2 requirement for SNFs to review the resident population and resources required. This presentation provides a summary of the report, including resident population served and care needs, staffing and competencies, and risk analyses. Assessment areas include resident population served and care needs based on physical and cognitive disabilities, care requirements of the resident population, facility staffing and staff competencies, facility resources, health information resources, facility and community-based risk assessment utilizing an all hazards approach. Next slide. This slide highlights the 13 neighborhoods by special treatment or care focus areas. Can we move on to the next slide? This slide shows the top 10 resident diagnoses for fiscal year 2020 to 2021. Overall, there were no changes from last year. Places 9 and 10 switched. Next slide. This slide shows the resident population served. There was an overall 53% and 54% decrease in admissions and discharges, respectively, from the previous fiscal year. During fiscal year 20 to 21, 153 residents were discharged to the community, 7 residents were discharged AMA or AWOL, 97 residents expired with a length of stay of 2,235 days. As of September 21st, 2021, 17 residents are discharge ready and waiting for housing. Average wait time from time of referral to securing housing is 365 days, which is the same as last fiscal year. Some barriers for discharge include lack of funding source and displaying at-risk behaviors. The next couple of slides show resident demographics for fiscal year 20 to 21. The top chart is acute and the bottom chart is for SNF. Overall, there were no significant changes. This first slide shows the distribution by gender. The next slide shows distribution by age bracket. There was a notable increase in percentage of patients in age range 65 to 84 for our acute. Shows the patient ethnicity distribution. There were no significant changes from last fiscal year. This slide shows resident cultural needs and our total certified bilingual staff. There was an increase in our number of bilingual staff last year. Oh, sorry, it's been updated. 144 is fiscal year 19 to 20, and fiscal year 2020 to 2021 has 201 certified bilingual staff. For fiscal year 2020 to 2021, Laguna Honda staff was comprised of 1,647 total employees, 1,248 full-time, 76 part-time, and 323 as needed. There were no significant changes from last year. Nursing continues to comprise about 60% of total staff. This slide shows the resident care staffing competency standards. These are the new training topics for the last fiscal year. There were a total of 24 new trainings and 36 CDPH approved trainings that provided continuing education credit hours to nursing staff. Every year, Laguna Honda Workplace Safety and Emergency Management Department completes the Hazard and Vulnerability Analysis, or HVA, to evaluate the potential for threat events and response in those categories using the hazard-specific scale. It is assumed that each incident occurs at the worst possible time, for example, during peak patient loads. The events shown here have the highest risk for LHH based on probability and severity. There are no significant changes across the board compared to the 2018-2019 HVA. The continuity of operations plans for all types of hazards. It was developed with the following information: leadership succession, priority and essential services, systems and resources needed to carry on priority and essential services, and alternative care facilities and emergency communications. This slide shows the fiscal year 20 to 2021 NIF Quality Assurance Performance Improvement Program topics. 2 new topics for this fiscal year include the Environment of Care Committee and the Laguna Honda COVID-19 response. The next slide is the continuation. The fiscal year 20 to 2021 SNF copy plan includes quarterly reporting to PIPs from 6 performance improvement committees: MedQI, Code Blue, falls, pressure ulcers, behavioral monitoring, and restraints committees. The slide shows the care improvement priorities and opportunities. To provide care effectively, Laguna Honda will need to close the gap between current competencies and competencies required by the resident population served. The care improvement priorities and opportunities identified are continued focus on trauma-informed and resident-centered care, and to increase compliance with staff training and develop methods to measure competency. The COPS committee determined the following CLOPI topics to have in A3. Resident ADL needs, pain management, pressure ulcers, falls, and antipsychotic medications. The EOC committee is a multidisciplinary group focused on the continuous improvement of the environment of care and takes a collaborative approach to providing a safe, secure, and comfortable environment to facilitate patient care. They resumed monthly reporting meetings during fiscal year 21 to 2022, and reporting topics include quality, life safety, preventive maintenance of patient care equipment, outpatient clinic, rehab, nursing, pharmacy, and wellness and activity therapy services. Laguna Honda's COVID-19 response. Since March 2020, Laguna Honda has been under protective quarantine as part of COVID-19 response to the global pandemic. South 5 is Laguna Honda's specialized COVID-19 unit. Safety measures include controlled access to Laguna Honda campus and hospital with a safety officer present at the 2 entrances. Staff are also screened upon entrance with COVID-19 symptom questions. Laguna Honda continues to work closely with local, state, and federal partners, collaborate across Laguna Honda departments, and use the expertise and leadership of the Hospital Incident Command System. The slide shows summary and next steps. Some highlights for our departments include campus safety for fiscal year 21 to 22. The San Francisco Sheriff's Department officers will resume K-9 unit rounds to assist with resident safety on campus. And our Equity and Culture Department, which was created in fiscal year 20 to 21, integrating equity, trauma-informed systems, and wellness to comprehensively address care experience for residents and staff. For fiscal year 21 to 22, they plan on contributing towards the stated goals in the DPH Racial Equity Action Plan and the Laguna Honda Equity A3. They will partner with quality management to improve and increase collection and analysis of equity data metrics for quality improvement. Thank you. Are there any questions or comments?
Thank you, Fiona. Mark, can you see if there are any public comment?
Sure. Folks on the line, if you'd like to make comment on item 6, please press *3 to raise your hand so we can acknowledge you. Again, *3 to make comment on item 6. I don't see any hands, commissioners.
Thank you, Mark. Commissioner Green, do you have any comments or questions on the facility assessment?
Well, yeah, thank you for this. And I know I asked a question earlier about the distribution of diagnoses, and whenever you can get around to that information, be just interesting. I am nothing but compliments for this work, and I really think you've got a wonderful structure. And as I thought about all of the various topics we've talked about in terms of goals and some of the things that have come out of surveys, corrective action plans, it seems to me that all of your initiatives, as well as the committee structure, will help to address, pretty much all of them. So I really didn't have any questions, just curious to know how we'll have updates on some of this work over the course of the next fiscal year.
Who can, Michael, would that be something
that
you can answer, or? Oh,
I can
Josh?
help with that, if that's okay, just because one, I want to recognize Fiona. This is her first time presenting to you all. I don't believe you all have met her before. Fiona is one of our analysts in the QM department. So a lot of gratitude for her and the work that she did. And she was anticipating to present with one of her colleagues who unfortunately called out sick. So I just want to commend her on completing the whole presentation successfully. In terms of follow-up, I really appreciated your question, Commissioner Green, earlier. I think that is definitely something that we can work on moving forward to ensure we're providing you updates. And perhaps it could just be another standing report that either we do quarterly or monthly, whatever makes sense around our quality measures. And then especially if there's anything in here that's of interest, such as the diagnoses. I think each year there's great questions around that, and that does seem to be something of interest. So we can also present an update on that as well. That's not a difficult thing to pull a report on at all. So happy to do that on a cadence that feels appropriate to you all.
Yeah, thank you. We get that, at the general, Leslie Safer does a really good job. So insofar as maybe, I mean, it's different parameters and so forth, but insofar as maybe you can parallel some of the work that she does, because it's really fascinating, and understanding what the quality parameters set by outside organizations are really helps us understand the progress that's being made. And of course, I'm just channeling my inner Dr. Chow by saying we need to get updates. Since he's not here, somebody has to do it, right?
Which I appreciate that. You are absolutely right. And, I will say out of respect and honor of Troy Williams, that's also part of our centralization of the quality management department to make sure each department is providing you with the similar updates so that you can have that comparison level. And so now that we do have a director of PI, just as the SFG does, we can absolutely bring that forward to you.
Thank you. That would be great.
Of course.
I have a question, and it seems as if just based on Fiona's reporting that it doesn't seem like there was anything that was in the assessment that was startling or unexpected or surprising. So I was just wondering, based on the data that has been gathered and analyzed, do any of you feel like there is something that we need to so if we are going to have ongoing reports, is there something we need to just particularly focus on, or was there anything surprising in the data that you think you might want to share with us? Michael or Naz or Omi?
There was nothing surprising to me. I mean, so one thing that's interesting about the facility assessment is it's a regulation requirement for us to do this each fiscal year. And this has only been probably for about the last 4 years. And so, year over year, it does not change much to your point. And it's assessing very similar sections. I think the one thing that we did learn this year actually, and that wasn't in the presentation, and I'll share with you in transparency, is around the RUGS assessment, which I know Commissioner Chow loves. And so because there's been a change as of October 2020 in terms of how those are assessed, and I also want to be mindful, I'm not a subject matter expert in this work, but there has been a change in terms of the RUGS coding and the way that it's assessed. And so the team's working on a new build in Epic so that we can be sure to analyze that as well. So not anything of concern, but just a challenge and or gap in our assessment this year. So we focused more on ADLs and kind of the diagnoses or changing conditions over the past fiscal year, since we didn't have that to compare to as we normally do.
Right. Thank you very much. Appreciate the report and appreciate you, Fiona. Thank you.
You did a great job, Fiona. Item 7 is consideration for a closed session.
Already. Oh, you're on mute, Dr.
Move to go into closed session.
And I second that.
All right, I'm going to check just to make sure if there's any public comment on this item, which is item 7. Folks, press *3 if you'd like to comment on the consideration of a closed session. Just for the folks online, what will happen is the meeting will, you all, if you would like to, can remain on this line as the closed session takes place. Electronically, the platform allows us to go into a private room so that the public is not there, but you all can hang out until we're done if you'd like. If not, then you can watch the video afterwards. Commissioners, we can go to a vote. Commissioner Guillermo?
Yes.
And Commissioner Green?
Yes.
Great, so please give me 30 seconds to move this over. All right, everyone, we are back into open session. Commissioners, if you would consider whether you would like to disclose or not disclose discussions held in closed session. Oh, everyone's always muted when we come back in.
Move not to disclose.
A second.
I will do a roll call vote. Commissioner Green?
Yes.
And Commissioner Guillermo?
Yes.
Thank you. And now I believe we are at a consideration for adjournment.
Move to adjourn.
Second.
I'll do a roll call vote. Commissioner Green?
Yes.
And Commissioner Guillermo?
Yes.
All right. Thank you, everyone.
Go
Hey,
Giants.
everyone.
Okay, see you all next time.
Take care.
Take care. Thanks a lot.